Got randomly paired on the golf course a few months ago with the husband of a patient that I treated a few years ago. Somebody was cured of her disease and so I hadn't seen her in a long time. Not only was that awesome, but it does kind of raise the level of personal responsibility to do a good job. There's a certain accountability that goes along with, I might run into this person at Costco.
Gynecologic oncology, it's a surgical subspecialty. It includes uterine cancer, ovarian cancer, vulvar, vaginal cancer, any reproductive type organ cancers.
In an area like Montana, there historically hasn't been a lot of subspecialty medicine, but there is a lot of need. It really was an opportunity to go somewhere where me working in an area would let people not travel, for instance, out of state to get medical care that they just legitimately need.
I love caring for women. I love walking side by side with them through some of the most difficult times of their lives.
In Gynecologic, I found the only subspecialty that included both surgery and long-term continuity. I really had a chance to get to know the patients I was working with. It also allows me to understand how hard it can be to make space in somebody's life around surgery and recovery. Came up with a patient recently that she was going to need to figure out what to do with her 2 dogs when she was recovering from surgery. That's a real thing, and I can at least empathize, if not help problem solve. I want to understand people and where they're coming from, meet them where they're at, and it's just a value of mine.
The Cancer Center here in Bozeman is a wonderful resource for patients.
Coordination is really awesome, and it's part of the benefit of having a smaller center, and so I can communicate directly with the radiation and medical oncologists as we need to involve them. I can communicate directly with their nursing teams. I know who they are, I know their faces, I know their personalities. For most people, budgets are real, gas money is tight. Having to stay in a hotel because of travel is not a trivial thing. So I think being able to provide care locally where people don't have to really seriously travel is a huge benefit. It lets people get in sooner, lets us be more effective just by being timely.
And I really feel privileged that I'm able to spend time with my patients. One of my goals is to always make sure they feel safe and listened to, that all their questions are answered. I don't ever want them leaving a visit not feeling cared for. I feel really privileged to be a part of their care.